The government says we're still not past the peak of the coronavirus outbreak, and the number of deaths is expected to increase further this week before they may start to plateau. The government insists there are some positive signs from the latest data and the lockdown is working, but it's too soon to talk about when it may end or how. 717 people are reported to have died across the UK from coronavirus in hospital, a drop from yesterday, but that number does not include deaths in care homes or in the community. It brings the total number of deaths in hospital to more than 11,000. The government has said it's reviewing whether people should generally wear face masks. The World Health Organization has acknowledged to the BBC the increasing concern in many countries that unless people wear masks more widely, they may be at greater risk of spreading the virus. Our first report tonight is from our Science Editor, David Shukman.
The grief is personal, but the pain can touch millions. When Anne McCook from Preston died, her smiling face was shared around the world. A source of comfort to her daughter Emma, who until the end had been looking at research into her mother's chances.
On the left, it was how many people had been admitted, and at that point she was on the left, she was in that figure. But then when she passed away on the 10th, she was on the right. She was one of the figures of death, and it's heartbreaking because to everyone else that's just a number. But that number was my mum. And I don't think people are connecting numbers and graphs and figures to real living people that aren't going to come back from this.
And Emma is desperate, like so many who've lost loved ones, for people to follow the rules. Over the holiday weekend, many usually popular spaces have been much quieter. But because of the impact of the lockdown on the economy, there are constant questions about when the measures will be relaxed. And at today's government briefing, the First Secretary, Dominic Raab, standing in for the Prime Minister, said it was still too early.
If we let up now, the virus will only take full advantage. It will spread faster and it will kill more people. If we refuse to give in to it, if we keep up this incredible team effort, we will beat this virus and we will come through this national test.
In Spain, badly hit by the virus, there is a slight relaxation of the rules. Factories and construction sites are allowed to reopen. Many worry it'll lead to a resurgence of the disease. So to minimise the risk, the police are handing out masks. Until now, the World Health Organization hasn't recommended this, but it is now recognising that wearing a mask is becoming more normal around the world.
It'll become, I believe, a kind of badge of responsibility, along with the other forms of behaviour that are going to be so necessary.
So you'd expect mask wearing to become more common?
Absolutely, I'm sure. It's a way in which people themselves can take action, and it's also a sign to others that they're taking this threat seriously.
The British government view is that the best masks must be reserved for health workers on the front line. That if everyone wants them, supplies will be even harder to find. Okay. But more and more countries, including the United States, believe that because people can have the virus without showing symptoms, they should cover their faces. Is it possible that you would change your advice to the British public about wearing masks when they're out of doors?
The evidence on masks is much more persuasive for masks stopping you giving it to somebody than it is for you preventing from you catching it. We are continuing to look at new evidence as it emerges, and if there's evidence that looks like we should change our advice, we would do so.
In Thailand, even newborn babies are being given specially made face shields, an effort to protect them from the virus on the journey from the hospital to their homes. And today, more faces behind the mounting British death toll. 2 nurses. Melukayan Ballesteros, originally from the Philippines, died in London at the hospital where she worked, just 2 days after being admitted. And Rahima Sidani had spent 50 years as a nurse after arriving in the UK from Trinidad. Aged 68, she'd refused to retire in the midst of the crisis. Her son described her as a nurse until the end. David Shukman, BBC News.
Despite the government reassuring frontline health staff many times that there are sufficient stocks of personal protective equipment, there are still shortages. The head of NHS Providers in England has told the BBC the supply of gowns, for example, is hand to mouth at the moment. The government says it's straining every sinew to resolve the problem. Hywel Griffith reports.
Basic equipment that can save lives. Millions of gowns, masks and gloves have been promised for use in this pandemic, but they still aren't getting to everyone who needs them.
To put it politely, I think it's been a shambles.
Nick is a GP registrar at a hospital in the southeast of England who says supplies regularly run out.
You go onto a ward, you're about to see a coronavirus positive patient, and then you end up not having, if you have the mask, you don't have the goggles or the visor. If you have the visor, you then don't have the gown. These are issues that still we continue to face, no matter how our government would like to believe and say otherwise.
Across the UK, frontline staff tell a similar story. At this hospital near Cardiff, one doctor reported nurses preparing for work with 4 visors, between 40 of them. The local health board says they do now have enough PPE. Doctors, leaders and healthcare unions have written to the Welsh Government to say their members fear for their safety.
People need answers. We can't go on like this as the death toll increases, as people see colleagues, friends of theirs, loved ones dying as a result of not having the appropriate type of armour that was needed for them to go out and fight this battle for us.
The UK's 4 nations have agreed to work together on sourcing equipment. At this Belfast hospital, they have PPE, but GPs in the city have threatened to withdraw service because of a scarcity. In residential homes, there's real anxiety too. The head of Scottish Care says PPE makers have been prioritising orders from England, leaving their stocks low.
I will never stand here during this outbreak and say these things are off the agenda, because we fixed them all. We will monitor that and keep on that on a day-to-day basis, such is the vital importance of it.
Daily deliveries of equipment have been pledged as part of a round-the-clock effort to give everyone the support they need. But real questions remain over why, after months of planning, some still received too little, too late. Hywel Griffith, BBC News, Cardiff.
13 residents of a County Durham care home have died after displaying symptoms of coronavirus. Managers at Stanley Park Care Home say they are devastated by the deaths. The first fatality was in late March, with the latest confirmed today by the home's operator, Care UK. It's not been disclosed how many other residents at the 72-bed home are ill. Well, let's talk now to our health editor, Hugh Pym. Hugh, deaths in care homes are not included at the moment in the daily death toll we get from the government, but the government has revealed tonight new figures about the spread of the virus in care homes.
Yes, Fiona, very tragic and difficult situations in care homes with concerns about protective equipment we were hearing there earlier. Yes, Chris Whitty, the Chief Medical Advisor, said at the media conference earlier today that 13.5% of all care homes in England had had outbreaks of COVID-19. That's equivalent to more than 2,000 establishments, 92 just in the last 24 hours alone. And as you say, deaths in care homes are not reported in the daily toll which we get, which are hospitals. The Office for National Statistics will come up with some sort of figures on community deaths tomorrow.
And last month, the government told us that the peak of this outbreak here would be yesterday. Today, the government's telling us we're not at the peak yet. So this is not progressing the way the government expected.
Well, we may be near the peak. And if we look at the figures for hospital cases, patients there with COVID-19, you'll see a flattening of the lines there. London, which had been rising quite fast, a bit flatter now. The Midlands also was going up. That's flat. The east of England has gone up a little bit, but Scotland and Wales are plateauing as well. So this could be the beginning of a peak. And it has to be said tonight, NHS sources are making clear that there is still capacity. They've built up a lot of extra critical care beds. They can cope at the moment, but no one's taking anything for granted. This pressure may well go on for some while for the NHS.